Well, hello. Welcome to another episode of Mind Your Mouth podcast. I am so excited today to have another amazing colleague. But as you guys all know, I try to bring people on that I also love as humans onto the show. And today is no different. Today, we're going to be chatting with Dr. Kevin Coppleson, who is a oral maxillary surgeon who has headed up the Breathe Max department, who has started this great movement of knowing more about surgical aspects all into this Airway, who works side by side with the one and only Zaghi. And we're going to talk all kinds of great things with him today. So let's welcome Dr. Kevin Coppleson. Hey, Kevin, welcome to the pod.
Thank you for having me. Very excited to be here. Very excited to see you again. Amazing.
Thank
I've
you
been watching
so
your
much.
podcast and it's been going amazing watching it grow and had really interesting guests on, and I'm honored to be here.
Well, I appreciate that. And I did tell everybody in my very first episode, the podcast was originally sprinkled into my mind from the one and only Laylee. She said a long time ago, she said, you probably should just go do a Rogan style Airway conversations because of who I am and all the way I like to communicate with people. And it's kind of always been lingering in the back of my mind. And I finally decided, this year, and it's been the best thing I ever did. It's just great to have conversations and talk to people about all the things we talk about off camera, on camera. And mainly the people that are listening are a lot of our people, a lot of myofunctional therapists. But I've been getting a lot of women, Kevin, a lot of women, moms that can really resonate with the struggle of sleep issues, anxiety, depression, all of those things. A lot of them just don't know where to start. So usually they start with their kiddos and then they wait to treat themselves later on. And I'm sure you see that all the time in practice.
Yeah. We see a lot of parents that, maybe they start with their kids and then, maybe a light goes off that, oh my God, maybe I have some of the same things that were untreated, and they end up kind of coming through my door. And
coming through the other way. I thought we would maybe start today a little bit is, knowing you could have went the regular route. And I remember one day right when you decided to join, we were sitting in one of the old, when they were doing the conferences downstairs of the building where they were doing the makeshift conference when you first decided, and you and Zaghi were talking about it. What made you kind of head down the Airway route instead of staying traditional?
It's a great question. I mean, I've been kind of singularly focused on the Airway thing since residency, which I think is pretty unique. I've known Dr. Zaghi for a long time, and we, back in the middle of my residency, we were talking about how we could collaborate and treat Airway together. Him as an ENT, me as a maxillofacial surgeon, and how those two specialties really do complement each other. And it's crazy because back then, we had that inkling, and, since then, practicing together for so long, it's even more intertwined than I had originally thought. And, sharing a roof with him has been pretty fantastic because a lot of the modalities that he treats, a lot of the things that I treat, some patients are maybe single variable patients where they just have really just one thing wrong with them. And if you fix that one thing, you'll make them better. But I would say most patients are multivariable, and they may have structural things, some soft tissue, some hard tissue. They may have myofunctional components. Like you talked about, there can be some central nervous system things over the years that have happened that we have to unwind. And, working at a practice like the Breathe Institute, where we have so many different specialties and I would say unique thinkers under one roof, we do get better and we do come up with new protocols over the years. Nothing's static here. The way I practice today is super different than I did when I started. But to answer your question, I me and Zaghi were just kind of singularly focused on Airway since my residency days. That made residency, I would say, a lot more specialized for me, in the sense that I knew I was, I wanted to become the best Airway jaw surgeon that I could be. So I kind of tailored my training as much as possible during residency and then fellowship. And
so that seed was already kind of planted even before. So you and Zaghi knew each other like even before the whole, like, how did you guys know each other before?
From like junior high school.
Oh my gosh. Oh, you guys knew each
So
other like really?
we
I
grew,
didn't even
we
realize
grew
that.
up in the same area and went to the same schools. So yeah, so it's really cool to, someone that you've known for so long and to have a vision together and believe in the same things and then follow through with it and it actually coming to
Come
life.
into fruition. Absolutely. I knew you guys like knew each other. I didn't even realize it was like that young.
Yeah, yeah.
So he had already planted. So you actually went into residency with a complete, like a different scope, like already knowing that you were, or like already kind of cured, airway curious.
Yeah.
Or like you
Yeah.
call it airway curious.
Yeah, and I will say like on top of that, like when you do residency and you start kind of experimenting with all the stuff, like my residency was a very kind of full scope residency. We do obviously corrective jaw surgery and stuff, but we also did a lot of trauma. We're in Baltimore at the Shock Trauma Center. We did a lot of cancer and reconstructive surgeries and stuff like that. So I really got to kind of see everything. And for me, like corrective jaw surgery was like the type of surgery that fit my personality the most. It was very rewarding. It was life-changing kind of for patients, like immediately, they'd wake up and, they'd be breathing better and they would look like a better version of themselves right away, which I loved doing impactful surgery. There's obviously other impactful surgeries like, cancer and reconstructive surgery is very
Yeah.
impactful and very important. And we need people that do those surgeries and help people in their most vulnerable state. But, X percentage of your patients were not going to be around in 6 months from the disease. And my heart and soul was not cut out for that, I don't think. But I did like to do impactful surgeries, and corrective jaw surgery for me gave me that satisfaction of helping patients and giving them better quality of life without having to worry about, mortality in 6 months.
Yeah. Cause you did, I mean, yeah, the level, like, by you doing corrective jaw surgery on someone with severe sleep issues, there's a chance they're really going to be able to enjoy the benefits and
I'm
really use their
yeah.
quality of life.
Yeah, and what you'll see is that it's like pretty immediate, which is really cool, and it's life-changing because I mean, as you know, treating patients that have sleep disordered breathing, it eats away at their life.
Yeah, it does eat away at their life. And it's, it's interesting to talk about something as terrible as cancer, which I can't even imagine what that diagnosis is. But I almost found, sleep disordered breathing diagnosis or having it is almost a slow, I almost want to use the word waterboarding, torture type of disease over a really long period of time. And I know, I always try to talk I always say I just talk about what I know and I just know myself. And I do know, side effects and these myofunctional issues. And I just think of my own scenario where you just are like trapped in your own body and you don't understand why basic functions are a little bit harder,
Mhm.
and that your number one enemy becomes your own mind because like you're just trapped in your head, and then you build all of these side effects that your body's trying to protect you, but yet it almost makes you a little bit hard to swallow at sometimes because it makes it so uncomfortable
Yeah.
because you're literally uncomfortable and nobody likes and no one really had a diagnosis for it,
100%. And it's very variable, right? Like it's really interesting to see how the central nervous system responds. Like you said, like people compensate, right? Your body will compensate to keep you alive, whether that is through clenching and grinding and forward head posture, or, some people become hyper arousable in their sleep and, they have insomnia, frequent arousals, or there's the sleep apnea patients that are just super exhausted, but they sleep through the suffocations every night. And it's like such a big spectrum of how people's brain responds to it. And that's why like treatment really needs like a big team of different providers to kind of unwind everything and kind of problem solve and figure out what's going on. But yeah, it's definitely a slow burn, a waterboarding kind of situation that repeats every night for these
Yeah.
patients. And the symptoms carry over to the daytime, and then it repeats again at night, and then again symptomatic during the daytime. And then they go through that waterboarding again at night. And it takes a toll. Like it really, over the years, it takes a toll on people. And that's why it is very rewarding, because when you have the patients come on their follow-up and you kind of inquire and you're like, so how you doing now? How's the breathing? How's the sleeping? How are you feeling? And when they're like, oh my God, I haven't been able to breathe like this or sleep like this in years. And, my kid came in, I had one this morning, my kid, patient, is pretty early on in expansion. And they're like, my kid came in my room and I didn't wake up. And that was unheard of, but they're actually able to go into like a deeper sleep than they normally wouldn't be able to. And obviously waking up more refreshed. And then obviously all the benefits that come from that, whether it's mood, cognitive function, and all of that stuff, they become better versions of themselves, or who they should have been if they weren't.
Yeah, it just makes
Waterboarded all night, every night for the last 10 years, so.
Yeah, it makes things a little bit just easier to, your body to digest when you don't have to constantly be, fighting or working harder. And I think behavior is such a, a thing that goes, hand in hand with it. And I think a lot about, when patients present and you see them with all these dysfunctions, and then you try to, to offer them a solution in a 3-pillar problem when it's just one, like someone will say, oh, it's expansion, or it's myo, or it's tongue tie. And, I absolutely, the time being able to work with, with Zaghi early on, especially when I was practicing before, TBI kind of first came, it always felt like you could get so far. And then it was like another mountain that was like, impossible, because you'd have to go, high and low to find somebody to have the conversation with. And when Dr. Zaghi first kind of came in and put together that first group of people, and it was, a pharmacist, and it was a sleep coach, and all that, it was Jenny June, and it was all the people coming together, and they're talking about how all of these pillars are so important to be able to achieve an outcome. It really was revolutionary. I mean, it was, even though it seems simple, it really wasn't. It was not very simple.
It wasn't.
Yeah, it was
Yeah,
really.
it was kind of like, tongue space, tongue tone, tongue tie. And, those are very important variables, and pillars, I would say, for sure. But, what I'm learning as time is going on is that there's even more, right? There's the nasal airway. The nasal airway has multiple different variables within that. There's, like the UARS patients, the insomniac patients, like those have so many other variables, when it comes to decompensating all the compensations they have, from, I would argue, the PTSD of their sleep.
Yeah.
So it, it gets deep. It gets
real deep.
It's really deep. It gets really deep.
Which, if you're okay, I'd love to chat a little bit. We actually, I shared in a recent presentation that 2017, years ago, Zaghi, I did a couple sleep studies with, and you guys had looked at it, and I'm very open. I actually just saw Soroush in Switzerland, and he kind of looked at me and he said, "You do look different, Melissa." And I said, "Thanks." But he was the first person when we had talked about maybe doing expansion or doing surgery on myself. I remember when he kind of pulled me aside and it was like, you got to figure out, you got to find a way to like work internally and like almost in a sense, like decrease some of the inflammation I had in my body, never mind just the weight. But I had lived in such a hamster wheel, whether it was the medications or whatever it was. And it was hard because I knew the things I needed to do. Mm-hmm. And the truth is, the deepness was I had to like heal some big things inside of me. And, the sleep issues, I had true structural issues, but I also had environmental issues, childhood issues, which we all have. I think some people maybe feel them in a way. And so they were really compounded on these levels. And so to do the work, I literally had to go pretty deep to heal things, to understand why I would be reactive or defensive, and then hold my breath all the time, or, constantly trying to like calm my nervous system. And I've shared with people the things I've done, as I've shared with you. But now you come to this place where I'm in my 40s and I am in a better, healthier place, body-wise, weight percentage, don't take meds anymore. Still need the caffeine because it's the only thing that can't
I like
can't
coffee too. It's
yeah,
okay.
I love the way it tastes, but I also recognize it's the one thing sometimes I just need when I don't, I'm more aware of it, but still need it. But so I know that I have this spatial space issue,
Mm.
and my grinding and my clenching has been an issue. And I feel it. I am a UARS patient, and I have a lot of patients that have it. And this question comes down to, are you a surgical case or can you do MARPE or expansion?
Yeah.
And I know it's not something we're going to just be able to answer black and white. So I just kind of wanted to just chat about it, right? Like, because there's pros and cons for both. And so I'm just curious, in your mind, what are some of some of the main, and it doesn't have to be about me, just in general, like when you know it's surgery, MARPE, is it both, right? It's all these complexities, like from your expertise and area, what goes through your mind when you're looking at people like this and having these conversations or helping make that decision?
Yeah, I mean, it really comes down to a patient by patient thing. At the end of the day, I try to give patients the best advice that I can give based on my experiences treating patients. And obviously, like, I'm very evidence based. So, based on like literature and things like that, the MARPEs nowadays are obviously really, really good. It's really going to depend on a patient's like demographics, their anatomy, where I make my decision, right? So generally, as a person becomes older, their bone becomes more dense up to a certain point, right? And as you get really, really old, you start to lose bone density again. But just in general, as you get older, your bone gets more dense. Men tend to be a little bit harder to split than women. There's other things we look for in terms of the anatomy, in terms of, do they have like tori or not? Do they not have tori? How thin is the bone of the palate? What is their starting dentition? Are they starting out with really flared molars buccally? Are they not? Those will be things that kind of determine whether we try MARPE first or just start with mind. There's other, kind of things, in terms of the type of expansion that I want the patient to get. Are they more narrow anteriorly or more narrow posteriorly? If we want to maximize posterior expansion, then I feel like we get that more with the mind surgery. You get kind of more even anterior to posterior expansion when you release the pterygoids. So yeah, it's really a combination of all of those things. So I'm kind of looking at, male or woman, how old, do they have a tori, how thin is the bone of the palate, because that affects how much anchorage you get with the TADs of the MARPE. Are they starting out really tip buccally? Do we not want to worsen that while we're trying to get them to split? And based on that, we'll kind of come up with a decision. On top of that, I would say proximity to me will be another thing. So flying in from Japan or UK, I may err on doing mine because it's kind of like guaranteed right away, minimizes the chance of them like not splitting and having to come back. So yeah.
So just for some of the listeners, as we're talking, so the question I kind of am asking, like, is it just this, MARPE or surgical? Really, and I should say that you did something pretty amazing. You kind of created am I wrong for saying almost like a middle option?
Yeah.
Would you say mind is a mixture of both coming together, or
it is? It's a minimally invasive surgery to allow for mid-face expansion. So basically, for patients that, like right now, the mind surgery is still based on MARPE-based expansion. So you're still going to have a MARPE. You still have to expand with a MARPE. It's for patients that, let's say, like they fail to split, all right, which happens sometimes, or patients that are in the higher risk demographic and we want to make sure that they split safely and predictably, or for patients that we want to get more posterior expansion or something like that. So it really kind of depends on those things, whether...
I mean, I think it's open. It's not like is that one of the reasons why you guys chose to do mind on Dr. Zaghi?
Yeah, like Dr. Zaghi was someone who had failed. I hope I'm not violating HIPAA, but he posts everything on a presentation. I don't think about it. Yeah. But like he's someone who failed MARPE. So he had a MARPE that didn't work. And so I did the mind surgery, which basically guarantees the type of expansion you would want to get with a MARPE in conjunction with a MARPE. So, the type of expansion you get with a MARPE is like kind of like Lefort 3 expansion. It's entire midfacial expansion. So including the zygomas, including the entire nasal cavity, obviously you still get the palate to expand. So it's kind of achieving that in a very, 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 very high predictable success rate.
You can control the outcome a lot. And are you doing a lot of that with like 3D printing and imaging, like setting that up? Or, like, are you able to use like all this great technology? I mean, technology is good and bad, but
Yeah.
I feel like 3D, I feel like technology has been really good for dental.
Yeah. Yeah. I mean, I almost everything I do is like fully 3D planned and 3D printed to some degree. So yeah, like the planning is all done three-dimensionally. Obviously, like the custom MARPEs are 3D printed as well. The vectors of expansion are planned in the appliance. So if someone has a cant to their face or to their jaw, you can try to correct it with the vector in which you expand someone. So it's getting better and better every year. It's pretty amazing.
And a lot of people that have that vat or that canter into the jaw, well, right? Is that not common to also create some asymmetries or asymmetrical concerns in the face? People that are maybe overusing muscles on one side more than the other. I mean, is this more common when you see people struggling with TMD issues or TMJ? Like, are these things that are
Yeah.
commonly found in certain patients that present with this?
So canting is pretty common, right?
Okay.
I would say 95% of people have a cant. Now, whether that's 1 degree or 5 degrees, but there's going to be some kind of canting in most people. It gets even more, again, talking about deep dive. I don't know how deep you want to go, but then obviously some people have just asymmetric faces in general. So then are you comparing, like, are their orbits also dystopic? So what are you comparing that canting to? So it gets kind of deep when you're kind of analyzing all that stuff, but it's pretty common in terms of like developing an asymmetry during expansion, which I think is what you were trying to allude to.
Well, yeah, or what I guess I was alluding more is like, some people will come and be like, hey, yes, they might have, they're crowded or whatever, but from a myofunctional standpoint, they'll say, oh, one eye looks higher than the other, my
Yeah.
cheekbones are off, but I'm also having a lot of clicking on the left, like, you know what I mean, and a lot of things. So you're seeing those aspects, and then their shoulders, and you see these like little like symmetry or symmetrical concerns throughout their whole body in some ways, that it appears that the bite is so connected, like it appears they go hand in hand.
Yes, it's very, very common where you can see like dystopia, the TMJs can be abnormal from one side to the other, clicking on one side versus the other, a cant. Yeah, it's very common. I think, a lot of them are kind of like long-term compensations that happen, from having a forward head posture and struggling to breathe normally. You kind of develop these kind of common patterns of what you see in people's bodies. In terms of, expansion cases, it's thankfully pretty rare to develop like something that becomes like worse than where they started off from. It can sometimes
Usually better afterward. Do you
usually
see
better after. There is definitely like, I don't know, maybe 1% of people that can get worse during their expansion. So that's something you have to keep an eye on, but it's really rare. It's just something you have to be like really kind of astute during the follow-up and just follow them. In terms of that, the biggest thing that I'm trying to find is like what the common cause can be is it seems to be from like asymmetric sinus sizes. So they have like, you'll see one side, they have really like nice big pneumatized sinuses. And on the other side, they have a smaller sinus. That's kind of like the number one thing that I've found as a correlation. But yeah, it's probably the number one thing you have to follow people for during expansion.
just to make sure on that?
Yeah.
So overall, how is mind going? Is the procedure something you're doing a lot more of? Do you find,
Yeah.
you guys have been doing it for a while? Well, right now, how long have you guys been doing it?
We've been doing mind since probably 2018.
Okay. And so is it
So
a pretty
2018,
standard
2019.
procedure?
Yeah, we do quite a bit of the mind surgery. It's I think it's a really great adjunct again for the people that I think are good candidates for it. It's really when I tell you minimally invasive operation, about as minimally invasive as an operation can be. We're usually doing them in office under like a twilight sedation.
Same. So it's not too invasive, pretty
Very,
simple.
yeah. I mean, it's obviously outpatient. Our patients that come from out of town, they're flying home after a couple days. By the time they leave, they are not really swollen at all.
So
Usually,
not a lot of inflammation, minimal, discomfort comparable from a, of course you're
compared
having
to
some
like
type of a
I
procedure.
would say like 1/4 as traumatic as getting your wisdom teeth removed.
Oh, wow. Okay.
Yeah,
So that's not so bad at all
it's
compared
not so
to,
bad. It's not so bad.
yeah, because there is a little bit more of a recovery when you do have a jaw surgery.
Yeah, jaw surgery is a bigger operation, a great operation, but it's a different movement.
Yeah,
Right?
I'm moving what it's, and I guess maybe just to go into the conversation of jaw surgery, there's a lot of buzz out there, people talking, and I've seen a handful of patients lately that they do look a lot different post jaw surgery than they did years ago. In 2015, 16, we would see some post op, and still bruising and stuff, but
Yeah.
it seems as though, I don't know, what I've heard is that the surgery doesn't take as long, maybe as it used to, because of 3D printing and imaging and how you can set up things like that.
Yeah.
Would you say that surgery has more efficiently, a patient are having better outcomes, or just the techniques have improved?
Yeah, so that's a great question. So I also pride myself on my patients not looking super crazy after jaw surgery because
Yeah.
I see post-op pictures of people online that look like,
Mm,
they were just in a UFC fight and they have tubes coming out of their nose and
yeah.
they're like a pumpkin. And my patients kind of maybe look like they got wisdom teeth out afterwards. I would say it's multifactorial. I would say like one of the big things is going to be like the custom surgery with the custom plates and stuff, cutting down on the OR time. Obviously, the less time you're dissected and stretched, your mouth stretched open, the less swelling and bruising and stuff you're going to get afterwards. Obviously, the other part of it is technique, right? Like how good do you dissect? How gentle are you with the tissues when you're retracting? And all of that stuff is kind of more hands, like how good are your hands when you're operating. So that's going to be very surgeon to surgeon based, right? How delicate they are in the way they operate with you. And then, yeah, like, I think custom plates like these,
Yeah.
um, traditionally we're adapting those by hand in the operating room, and that eats away some time in the OR. So having the accuracy of these plates and not spending time adapting them. I'd say the other benefit of these plates is that they are extremely rigid. So, the traditional plates that you bend by hand in the OR, they are designed to allow you to bend, right? So inherently they're going to be a little bit softer or bendable. So what does that lead to? I think, a higher chance of getting a little bit of relapse after the operation from muscle pull and things like that. With
So the
these plates,
stability of the new ones being a little more rigid gives a little bit more support, so you don't have as much. Is that
correct. You don't get as much or if any relapse after the
at
operation, which
all?
is huge. And on top of that, if you're good at getting them in the bite that you want in the operating room, you don't have to like wire people shut or rubber band them shut or anything after the operation. They get a kind of,
Which that's a big deal. It's pretty scary for a lot of people to be wired shut.
it is. And it's funny when people come to me for a consultation, it's almost like they expect that to be part of the post-op. And when they hear that they don't have to go through that, it's kind of like a relief, in terms of what that really translates to afterwards. I think it's just, when you're not wired shut or rubber banded shut or whatever, it just takes away from some of the claustrophobia that you could feel from
Mhm.
that. Obviously, it's easier to talk and drink and take your medications and all that stuff. So,
Well, you don't realize the mouth, is very vulnerable. It's very sensitive. It's very
yeah,
intimate. There's a lot to it, and being in, and taking that away from someone, even for a short period of time, can almost feel really constrictive and
yeah,
create a lot of fear and anxiety within the body, because and then they want to clench more, and all of these aspects, because the body almost goes into a little bit of fight or flight. And I feel like now, because people are hearing and seeing things different from these surgeries and these outcomes, I think one positive about social media is you have a little bit more access to people. I had a patient the other day that said when she thinks about surgery, she thinks about the real like Road Rules, one of those old MTV shows, because one of the cast members had jaw surgery and they kept showing this like horrific, like angry face. And she was, and that's all I ever think about is like this uncomfortable feeling. And I think, I think so many people have an idea of what it's like, and that creates fear. I know it does. Listen, me not, that thought of just having that constriction in your jaw is scary. Also,
Yeah.
the cosmetic change. I
Mhm.
think that's an aspect I hear a lot of patients talk about, that, your face is the first thing you see. So like, you might not like the way it looks, but it's almost scary to think what it would look like if it's different, right?
Yeah.
So
So that's a great point. I think of jaw surgery as like the holy grail. Like I told you, just, in terms of the life-changing aspect of it. But I think it's a powerful surgery, not just for your airway, but also for facial aesthetics. I think if you go to the right surgeon, if you go to a good surgeon, like one of the things I like to ask people, first of all, I want to make sure that they're reasonable, right? But I'll ask them, I'm like, I can kind of keep you looking the same and still make a massive change to your airway and how you sleep. So some patients are like that. They're like, I just kind of like as similar as to how I look now as possible. And you can do that. There's some patients who are like, okay, like while you're there, can you work on stuff, right?
yeah.
And I can, so I'll kind
No,
of,
wait, you're in LA. People want to fit. No, I'm just joking.
yeah. I mean, I just published a book chapter in Advances in Cosmetic Surgery book, which is one of the big cosmetic surgery books,
Wow.
because of I think jaw surgery is probably one of the most powerful facial aesthetic changing tools that you can do. And obviously, I talked about all the different procedures that I do and how that affects facial balance and harmony and aesthetics, and showed off a bunch of cases in there and stuff. But one of the things I tried to emphasize to the cosmetic surgeons is that, one of the benefits of the stuff that I do is that it's functional and cosmetic at the same time. So if you have a patient, for example, that has a retruded chin, instead of putting a silicone implant in there, know that someone like me exists where I can treat that and then also help their airway at the same time, right? Because they may have some underlying airway issue if they're super retruded. But
Is it fair for us to say that most people that are desiring a chin implant most likely also have a retracted mandible?
I would say yes, about
Yes.
99%.
They're pushing you in. I know we
They're,
can't make broad statements, but well, you
no,
can. I can. I
let's
can
say
say whatever crazy
let's
thing
say
I want.
let's say 99% do, and they probably have some underlying sleep disordered breathing that's undiagnosed. So my point is, like, I have a lot of power when I'm there. Obviously, like, I'm going to make your face more symmetric and your jaws more symmetric, but on top of that, I can really custom tailor the operation to, like, do you want to look like as similar to as you do now, or do you want some changes? What changes are you looking for? Like, give me like a celebrity that you want your face to look more like, and you want to make sure they don't say anything too crazy. But I like a patient that told me like Anne Hathaway, right? And she
Okay.
showed me some pictures, and I looked at Anne Hathaway's jaw, and I'm like, I think that would look good on your face, and we did it, and she looks gorgeous. So it's a surgery where
That's a powerful thing to be able to come in and say, I really ideally would like this, and be able to
obviously I
mimic
can't make her whole face turn into Anne Hathaway, but if you like,
no, 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 no. No, and not like,
yeah,
but
yeah,
also powerful to be able to give, that
yeah,
kind of
yeah,
line and lineage of the jaw contour and the positioning and the shape to
for
really
sure.
create. I think that's like, I mean, it also shows what an art it is too, right? Sculpt,
It's
like,
it's it's totally an art, and I like, jaw surgery is the type of surgery you only want to do once in your life. Obviously, I do a lot of revision cases. I'm doing people's second surgery because they didn't like their first outcome somewhere else. But when I'm there, there's so much I can do. I can augment the cheekbones. I can do contouring of the mandible. I can contour the chin. I can, there's a lot that I can do while I'm in there. So, I think it's a really special operation because obviously I'm very airway focused and stuff, but the airway and the aesthetics, they go very hand in hand. Obviously there's, other stuff you can do like fine tuning the lines of the jaw and stuff, but overall, generally, if you put people in an airway beneficial place, you'll make them look like a better version of themselves and they'll be happy.
because if the body's getting air and it's pushing it, they're going to live healthier, and
Yeah.
they'll be functioning better, and they won't be straining so much.
Yeah.
Do you find that there are patients that in a lot of cases that, you know, could benefit from doing MARPE and jaw surgery? Like, is that
Oh my
common
God.
too? Both?
100%. So
100%. Okay.
I would say at least 50%, if not more, of my jaw surgery patients, we expand them first.
Which
Right.
I think that's a little bit where people, especially from the myo world, and you know, I love my myo, and I think myofunctional therapists, we have lots of moving parts when it comes to our job. In a lot of ways, we have a lot of access to the patient. We spend a lot of time with the patient. We get to know them. And so I say this with grace, we do have a little bit of liberty, right? Sometimes that we can support or coach someone's decision, and you have to do that with integrity and really be mindful of how you're handling that. But I feel as though if we were to poll a lot of myofunctional therapists, a lot of them think it's and or, right? It's expansion or surgery. And I think that's not a really, I think we should use this opportunity to really
Yeah.
talk to them about both.
Yeah. But there's some patients that don't need expansion, that go straight to jaw surgery. There's some patients that don't need jaw surgery, they just need expansion. There's a lot of patients that need both. There's a lot of patients that are transversely hypoplastic, and they're also retrognathic, right? The jaws haven't grown wide enough and they haven't grown forward enough. At the end of the day, like, I'm happy when my patients are happy, and my patients are happy when, you know, they're cured and they're sleeping better and they're breathing better and they like the way they look. And so all of that sometimes takes a staged approach to get, you know, a little bit better
Which
results.
I think I would agree that I would say, and I don't know, I think you'd agree, is that I think the older you are and the longer you've been living with these things and the deeper the issues, takes a stage approach. And I think that's something you always kind of put pretty forefront at Breathe Institute in all the parts of the practice, was that it was never a single man show. It was always this collective approach. And whether it's staged out treatment or using myofunctional therapy or alternative care, understanding that you guys could fix everything structurally. You could be perfection, but yet if somebody really had muscular behavioral issues or lifestyle issues and dietary issues and medical issues, that you were only going to be able to take them so far.
Mhm.
Well,
Yeah.
Dr. Kevin, thank you so much for joining us. We leave one little thing every guest is we just ask them, what does mind your mouth mean to you? What's the first thing when you think of when we say mind your mouth?
Well, I would say, you know, the mouth and the jaws are the gateway to your airway, and your airway is the gateway to your sleep. So I would say, if you feel like there's something wrong, see someone and have them take a look, because you can learn a lot just by peeking in someone's mouth in 2 seconds, and you can get a pretty good idea on how well they breathe through their nose and how well they sleep and whether they clench and have TMD or anything like that, just with a 2-second peek in someone's mouth. So I would say, don't let the smoke turn into fire.
Oh, that's
Yeah.
perfect. Well, thank you so much. We can't wait to catch up. We hope you will join us again. Thanks so much.
Hopefully
Till
time.
next time, guys. Thanks for tuning in.